Spinal cord stimulation is a great treatment. It's been around since about 1967 was our first implant. The good news is that technology has continued to improve. What exactly is it? Well, this spine model kind of shows it. If you can look real carefully, you can see the little electrodes here that sit just behind the spinal cord. The idea behind it is you're going to be placing small electrodes through a needle to help kind of control somebody's pain. We use this for multiple different things in pain management. One of the things is people who have had maybe previous back surgery or neck surgery and may still have continued pain. People who have diabetic neuropathy that may be very painful, that may not respond to medications, and finally any other kind of neuropathic pain. This treatment has been very helpful for a lot of individuals. It's kind of unique in a way that you get a trial to see if it's even beneficial before you move forward. That is always a first step. One thing we do require is a psychological clearance and evaluation, and that's not us requiring it, it's your insurance company. They want to make sure that somebody has discussed the fact that it is a trial to begin with, and if there's a good result, a permanent implant will require an implant in the body, such as these electrodes we talked about, and there's usually a battery pack that would also be installed at that time. Everything would be under the skin, nobody would see it, but again, the implant is only done if the trial is successful. For most patients, this trial will last between 5 to 7 days. It's very important during that trial that you do not take the dressing down. The dressing has to stay on the entire time. And you will also not be able to shower or get that dressing wet. That's a tough one sometimes, but please do not get the dressing wet. It's very important. At your follow-up visit, usually 1 week later, we will take the dressing down and remove the temporary leads. At that time, we'll evaluate how successful it is. And we're typically looking for a minimum of 50% relief, upwards of 80 to 90% for a lot of individuals. If the trial has been successful, we would make a recommendation for permanent implantation. However, if it was unsuccessful, we would certainly not recommend moving forward with permanent implant, and the trial would be ended at that time. We will see you back 1 week later. Again, dressing should not be taken down. And finally, any blood thinners that you're on need to stay off the entire duration of the trial. That's very important so that we don't have any problems or complications.